Good morning, everybody. Today is September 2nd. This is your quick COVID update. I'm Dr. Duc Vuong. In the news, Joe Rogan came down with COVID, and his vaccination status is unknown, but he says he's feeling okay. He didn't look so good in his video post, but he's taking everything, including monoclonal antibodies, all sorts of steroids, breathing treatments, and yes, ivermectin. And he's relatively young and relatively healthy, but prayers go out to Joe Rogan. The numbers are not good. Yesterday's number, 210,000 cases in America alone. And that's on a Wednesday number. So that's a real number, 210,000 cases. Our average is up to 166,000. So yesterday I talked about possibly plateauing. I don't think so, man. I really think we're going to keep going up. You look at the maps, and sure, Missouri's cooling off a little bit, and Arkansas maybe, and Louisiana a little bit, but not by a lot, guys. And the numbers are going up worse and worse and worse in the East Coast, and we've got surges still to hit Chicago and the Midwest, so it's coming. I just don't see this plateauing or slowing down anytime soon. And we've got all these natural disasters, schools starting, colleges, universities. Yeah, but Dr. V, what about, who cares about cases? I care about fucking cases. It's deaths that really matter, right, Dr. V? Like, deaths definitely matter. But cases is like speedometer, right? Like, how fast are you going? You got to know. I mean, because if you get in a wreck going 10 miles an hour, it's going to be a lot worse if you're going 100 miles an hour, right? So it's one measure of driving a car. You got to know what gear you're in. You got to know how much gas you have in the tank. But it's a very important indicator, the number of cases. Now, what I want to talk about today is vaccines and vaccinations. All right, comment if you know anyone who says, why get the vaccines? They don't work. Vaccines don't work. Shut the fuck up. Vaccines do work. All right, here's a problem. There's a second half of the equation that average people, and you're not average because you're watching me, average people don't know. So you can't say the vaccines don't work. What the real question is, against what? What are you measuring it against, okay? So the vaccines definitely work against, prevention of death. We know that greater than 99.5% of people dying from COVID are unvaccinated. They're in the hospitals. They're the ones dying. And yes, there might be people dying at home, but you can't worry about unreported things. Those are assumptions. You just have to go with the numbers, right? But people are sick at home and they're not really being tested and they're surviving, so death rate's lower. Like, dude, that's an assumption. Like, you think she's pretty, you're assuming she's not your cousin, you know what I mean? Like, you can't assume, man. Like, you just got to go with the numbers you got. So the numbers we've got are that over 99.5% of people dying are unvaccinated. So less than 0.5% are dying, are vaccinated. So it works very well. So you can't say the vaccines don't work. You have to say against what? What are we measuring? Against death? It works very, very well. Against hospitalization? I mean, initially it was 98, 97%, and now with the Delta variant, sure, it's dropping down. 95% are hospitalized. 5% are hospitalized. I'll take my 5% vaccination. Like, it's very effective against hospitalization. And then it's, what about severe disease, Dr. V? Well, how do you measure severe disease? Are you talking about really knocked down for a week? You're really struggling at home, coughing, but there's not enough hospital beds, so they're not admitting you, but you're struggling, right? Severe disease. That's still really good. Probably 90% if I had to guess. But again, those numbers aren't readily apparent, partially because some stupid states aren't reporting numbers regularly, or counties even. And so, you just have to take the data what they are. Now, but people will say, but Dr. Vuong, the vaccines don't keep you from catching the virus. What's the point? Nothing keeps you from catching the virus except like a full body condom. And even then, that might not work. Who remembers in the early days of HIV and AIDS, and people were all scared, and we were talking about putting safe sex as two people with like full condoms on, like full body condoms. There was like Saturday Night Live skit or something like that. Remember, virus is in the air, and so it's an airborne illness. And yes, it's droplets. It's not aerosolized. And so nothing keeps it from landing on your nose, okay, and in your oral pharynx. So the vaccines don't prevent that. So you can test positive, but that doesn't mean you get the disease. It's very effective against disease. And then, really, like, unless you're going to stay home and never go out and wear a full body condom or a hazmat suit. And even then, that might not be 100%, because condoms aren't 100%. Birth control pills aren't 100%, but you still, take them. It's ridiculousness. So when people go, but vaccines don't keep you from catching the virus, well, duh, they're not meant to. Like, I can tell you that's a zero. Like, absolutely, you're totally right. But are you sick? How bad are your symptoms? And obviously, you can go all the way from asymptomatic to dead. Okay? So what we're trying to prevent is dead and hospitalization, and then moderate to severe illness. So moderate to severe disease, it's very good at protecting people against that. And and we don't know the exact numbers yet, but we have pretty good indications that it's even keeping you from having mild disease. Now we can say you'll have milder symptoms. We don't know the exact numbers of mild diseases for the reasons people say. Maybe they're not getting tested. Maybe they're staying at home. All of that's true. But don't misunderstand the point of vaccinations. And, if you keep watching this channel, you're going to get smarter. I promise you. I'll be back with another COVID update tomorrow.